Hey guys, it is me back with another video on pathology, and in this video I will be discussing cardiomyopathy and cardiac tumors. So let us begin. So guys, what are the basic principles? So this cardiomyopathy is the myocardial disease resulting in cardiac dysfunction. Okay, so coming to the dilated cardiomyopathy, this is a condition in which all the heart chambers they get dilated, as you can see in this diagram. Okay, and it is the most common form of cardiomyopathy. Okay, and the result of this cardiomyopathy is that there is a systolic dysfunction causing biventricular congestive heart failure. As all the heart chambers are dilated, it will be difficult to fill the heart. Okay, and there will be systolic dysfunction. So what will happen that the blood which is being pumped by the heart is less. Okay, so the complications of this disorder are mitral valve and tricuspid re, regurg- regurgitation. Okay, and the etiology is unknown. There is idiopathic. This is the most common form of the etiology of this cardiomyopathy, dilated cardiomyopathy. Okay, and second is a genetic mutation. That there could be some genetic mutation which can lead to the dilated cardiomyopathy and myocarditis. It is also cause of this disorder: alcohol abuse, not to mention drugs, and pregnancy. Treatment is only one. There should be a transplant of the heart. Now, coming to the hypertrophic cardiomyopathy, as you can guess by the name, there is the hypertrophy of the left ventricle. So the blood which is coming from the pulmonary veins into the left atrium and into the left ventricle, that blood is less. Okay, the blood which is coming to the left ventricle is less. Why? Because the left ventricle is hypertrophied. The size of the left ventricle is increased. Okay, so the space um, which is taken by the blood is less. Okay, so that's why the blood which is being pumped from the left ventricle into the aorta is less. Okay, so that causes the it causes the this hypertrophic cardiomyopathy. And the common cause of this is the genetic mutation in sarcomere protein, most commonly the atrial dysfunction. Now coming to the clinical features, so we have got decreased cardiac output. Why? Because the blood which is being pumped by the left ventricle is less. Okay, and and in young athletes we get sudden cardiac death due to ventricular arrhythmia. Okay, and the third is syncope with exercise. Now the idea here is that like when we do when we do exercise, okay, the blood required for the heart as well as the brain is more. Okay, and as the cardiac output is less, so the blood which is going to the brain will be less. Okay, so that will cause syncope. Okay, now biopsy indicates the myofibril hypertrophy with disarray. Okay, now actually normally the the heart muscle, that is the myofiber, is arranged parallelly, like very organized order of the myofiber. But in this case, there is a disarray. Now coming to the last type of the cardiomyopathy, we have got the restrictive cardiomyopathy. In this case, what happened that the decreased compliance of ventricular endomyocardium, compliance of the ventricle is decreased. Okay, so you can think it of like this: the compliance means means how much the heart can stretch. Okay, so the stretching of the wall of the heart is decreased. Okay, so that causes the diastolic dysfunction, that is the restrictive feeling during diastole. Okay, so the causes of this restrictive cardiomyopathy are various. First is the amyloidosis. Uh, there is the abnormal protein deposition in the ventricles, causing the decreased compliance of the ventricle and causing this restrictive cardiomyopathy. Second is the sarcoidosis. Third is the hemochromatosis. In this case, what I mean, the iron buildup is too much in the ventricle, causing the decreased compliance of the ventricles. Okay. Fourth is the endocardial fibroelysis, which is especially seen in children. Fifth is the Loeffler syndrome, and yeah, and this all presents as congestive heart failure. Okay. Classical findings include the low voltage EKG and the diminished QRS amplitude. Now coming to the last section of this discussion, cardiac tumors. We have got only two types of tumors, myxoma and rhabdomyoma. In myxoma, what happens that there is a benign mesenchymal proliferation with a gelatinous appearance. Okay, so what happens in this case is that there is a tumor in the left atrium. Okay, causing the blockage of the blood flow from the left atrium to the left ventricle. Okay, and and on histology, we see abundant ground substance. Okay, and this is the most common primary cardiac tumor in adults. Coming to the last type of the tumor, that is a rhabdomyoma. In this case, what happened that there is the benign hematoma of cardiac muscle. As you can see in this diagram, this is the diagram depicting the cardiac rhabdomyoma. Okay, and the most commonly primary cardiac tumor in the children associated with a tuberous sclerosis. Okay, this point is very high yield, and this is often tested in the USMLE. Okay, and it usually arises in the ventricle. As you can see in this diagram, this whole bumps, these all arise in the ventricle. Okay, so that concludes our discussion on the cardiac tumors and cardiomyopathy. Thanks for watching, and take care of yourself, and remember to subscribe कर जल्दी ये सब्सक्राइब कर जल्दी ठीक है ना